Hello and welcome to the Crick Crack Science Live Show. I'm Valine McDougall from Upcoms PR. The Crick Crack Science Live Show is where we aim to spark curiosity and raise awareness and even help enable access to science by helping those in STEM fields share their stories. In today's program, we're chatting about some translational science towards improving the care of women, or I should say older adults, with cancer. Our special guest today is translational scientist Dr. Nikesha Gilmore, who is also an assistant professor of surgery in the Division of Supportive Care in Cancer at the University of Rochester, New York. I should say, University of Rochester Medical Center, New York. She's a molecular pathologist by training, and one of her goals is to improve the lives of older adults with cancer by addressing the side effects of treatment. Her primary research interest is the development of interventions to target frailty in older adults with cancer and to develop evidence based solutions to foster health equity for older Black patients with cancer. I have to also mention that our guest is originally from Trinidad and Tobago herself, and I've known her for many years. We went to high school together, and so I couldn't be more proud to know her and to have her on today's program. So, welcome, Dr. Gilmore. Hi.
Thank you. Thank you so very much for having me. So excited to be here today.
Really happy to have you, Nikesha. Okay, so I guess let me start by asking you if you can tell us what is a translational scientist? What's that about all about?
So a translational scientist is a scientist who's able to use basic research. So when you think about basic research questions, and if we're thinking about, if we look on TV, we'll see like those people who are sitting on the lab at the wet bench where they're looking at things in a test tube, and you're looking very specifically at very basic molecular questions about how does molecule A cause something in molecule B.
Mhm.
And so this is mixing this basic science research questions with clinical research outcomes. So in this case, looking directly in the patient. So I'm looking at research in the patient, but then we might also take some of their blood samples or other cells. I mean, looking very specific at the very basic molecular question at how molecular mechanisms happen in the progression of disease. So it's looking at those both two things, so not just looking at directly in the patient, but also looking at some of these very basic molecules.
Interesting. So, and is it sort of taking the science of it and trying to find ways of bringing it into medicine to actually have applications for treatment and so on?
Yes. And so the way that people like to say, another way people like to call translational research is from the bench to the bedside. So if it is that we know that, a specific molecule, and if we're looking in terms of cancer, we know that specific molecules involved in inflammation might be more responsible for certain outcomes of patients
Mm,
after receiving chemotherapy. Then we can say, okay, well, how does this molecule that we found on the bench how does that actually function within the human being in their cancer in their cancer outcomes? And
inter-
so it's like really bringing that science from the bench, bringing it right to the bedside.
mhm. Interesting. So now your research involves addressing possible effects of cancer, as you say, and cancer treatment on older adults. What really motivates you to keep going in this area, this field of research, or why did you choose to study this area?
I would say, well, I was always interested in from time I decided I wanted to do more research. I was really interested in cancer research, and specifically in older adults. The outcome that I study right now, which is called frailty, and I can describe what that is later,
Mm,
became I really mostly stumbled into this field because I didn't really understand this field. But as I learned more about older adults and cancer, I became really interested. And what we do know is that more than 65% of all new cancer cases happen in patients who are over the age of 65. And so it's really important as we're thinking about new treatment and some of the toxicities, like fatigue and all of these other things that we can see when patients are having cancer treatment really impact those older adults because they are the the greatest population of patients that will be newly diagnosed with cancer and receiving treatment. And I have personal experiences with cancer in my family, especially in older adults. And as the more that I learned about cancer treatment and the outcomes, specifically frailty, it made me reflect a lot on our own personal experiences and my family's personal experiences with cancer, and made me feel like I wanted to be part of that change. And so that's really, and all of the work that I do is really because I have a very personal relationship with my research. So how is it that I can make things better for older adults? Because all of us will become older adults. We're all really attached, or were attached to our grandparents or grand aunts, grand uncles. And then I'm also a Black woman, and how can we make any of the outcomes for people be more equitable? How can we make things more just? How we can make things more fair? And I really truly believe that I can use my vehicle, which is science, for justice, to improve and achieve equity, especially in my field where I can study, and the platform that I have, which is in older adults with cancer.
Yeah, really excellent. Really, really excellent. I mean, you talk about relatives, and I myself have had relatives who've battled cancer, and looking at them and seeing the effects that the treatment, would have had, and how they've changed between even successfully overcoming the cancer, but even how they would have changed. And so I really appreciate that is what motivates you, because you're really connected to it. So now you won a lot of awards for the work that you're doing. Congratulations, by the way. But for your work, and one of these subjects you just mentioned is the issue of frailty, and perhaps even, well, from what I've read, a little of what I've read, you looked at perhaps preventing frailty in some ways and being able to predict frailty. Can you tell us a little bit about your findings in
Yeah.
that?
So what we know is that, so I'll first describe what frailty is. Frailty, we have defined it as an aging-related concern. And what we know is that if we look at someone as they age, so from like the 20s, their 30s into their 70s, we all have a feeling. We can say that somebody will look at them and you say, well, this person is frail, but really, what is it? And so it's like an accumulation of what we've considered the deficit. As we get older, we might have more cognitive problems. We might have more problems with our balance. We might have more problems with our physical activity. And this accumulation of symptoms, we call it as frailty. What we do know is that when people undergo cancer treatment, people over the age of 65, but even younger people, so even kids who have pediatric cancers, after you've received cancer treatment, this collection of symptoms that we consider as frailty gets worse. And what my work has shown is that inflammation in our blood that you can measure from your blood can predict who will become or who is at greater risk of being frail after treatment. So we do know that if patients have higher inflammatory markers, and we look at certain molecules like IL-6 and C-reactive protein, and these are some molecules in our body that generally, so if we have a bacterial infection, let's say we got caught, we have a bacterial infection, or you ate some bad food and you have a stomach inflammation, and we know that our bodies naturally is able to have an immune response. And in that immune response, we have an increase in all of these inflammatory markers. And that is supposed to be protective. So it helps clear the bacteria, it helps clear the virus, and it helps us to be able to get over whatever it is that we were facing. As we get older, what happens is that we call this a sterile inflammation. So we have elevated levels of these markers in our blood without the presence of any bacteria, without any virus. And this chronic inflammation, due to a variety of factors, which I can talk about later, has been shown to be associated with people who are more frail. So people who have much higher levels of this are more frail. And if these levels become even higher while you're undergoing cancer treatment, you're more likely to become frail. And so by knowing what these molecules are, then we can take a step back and say, how can I intervene? Can I give you something that can reduce these markers? And so I have some studies right now ongoing where, one, we are trying to see if we can give patients a dietary supplement where we can reduce these markers of inflammation. Or what I'm going to be testing is whether we can reduce inflammation in their blood and also test to see whether patients are less frail.
Interesting.
And then in the context of health equity, I know a lot of us, we will know that if we're really stressed, I don't know if you know, anytime I'm really stressed, after that stress response happens, I'm going to get sick. Like, and your parents will always say like, oh, your system is really down. You have to boost your system up, right?
Mm-hmm.
And so there's a lot of science behind it that shows that when we are really stressed, it can cause a lot of heightened inflammation in our bodies as well.
Mm-hmm.
And so when we think about a lot of the stresses that people of African descent in many different countries, and I'm studying it in the context of the US,
Mm-hmm.
face, and all of the disparities and the discrimination that people face, that causes a chronic stress response. So you're living like if you're always stressed out because of the system around you. And
Mm-hmm.
so because of psychosocial stresses in our system, it has been shown that Black individuals or patients or people of African descent, because of the psychosocial stresses, have higher levels of inflammation in their bodies, and they
Right.
have higher levels of frailty. So if we're thinking about it, inflammation is causing frailty, patients of African descent have higher levels of inflammation because of these psychosocial stresses and higher levels of frailty. That causes a disparity in itself.
Right.
And can think about it when we look at cancer-related outcomes, we can see just the data shows us that patients of African descent are higher likely of having certain cancers and dying from these different cancers. And
Mm-hmm.
this is not mostly due to our biology. This is really mostly due to the psychosocial stresses that we have to live in this world. And so is there things that we can do on the research end? Systematically we have to change the system, and
Right.
but I'm not I that's not
You can use the
that's not the
science.
speed. I can use the science. And
Yes.
so from a science perspective, what can I do? And
Yeah.
can we start targeting some of these psychosocial stresses? Yes. And can we start targeting the information that is a result of these psychosocial stresses to help improve outcomes for these people?
Yes. So that brings me to the other question. It has to do with the equity that you talk about. In your research, have you come across sort of solutions then to what maybe governments can do, or even people in society with this information right now? What changes we can make in our lives or lifestyles, or even policy changes perhaps to to reduce the possibility of frailty, when we're aging. And though you're in an American context, I'm sure it could possibly apply. So I'm really interested to see if you've come across possible solutions in that sense.
And so there's, um, like, if I want to head in the sky, if everything, all the stars can align, we really need structural changes, right? We need systemic
Yeah.
and structural changes that have over time allowed
Mm-hmm.
people of African descent to be disempowered,
Okay.
um, and which causes us so many different. A lot of the health disparities that we see is due to these disparities. A lot
Social.
of the social factors and these social structures that have been actually strategically put in place to disempower people from African descent.
Mm-hmm.
And so that ultimately needs to change. There's lots of things that have to happen from the government level all the way down.
Right.
But in the context of what I can do in my own span, we can all do. Even when I'm speaking to undergrads and high school students, wherever we sit, there's something that we can do. So you just figure out what it is that you're good at and figure out how it is that you can make change in that circle. And
Mm-hmm.
so my research is looking at this the role of the psychosocial stresses and inflammation, and see if we can target the inflammation.
Mm-hmm.
Other things that we've known is that and I think what COVID has really brought up and like is very apparent now, so many
Mm-hmm.
of the differences in terms of trust. So we think about, okay, and I'm not an infectious disease person, but I'm just going to tell you from my side how I'm
Mm-hmm.
using this aspect of trust.
Mm-hmm.
So when it is that we as society have problems with trusting the powers that be, then this is why we were seeing lack of uptake, reduced uptake in the COVID vaccinations, because
Yes.
people were not trusting. And they were not trusting for a very good reason, right? There were things that have happened systematically in society, right, over the
Right.
decades, over history, that has instilled a distrust in powers that be. And this happens also in the healthcare system. And there's a lot of mistrust. And then there's this term that people call white coat syndrome. I experience it when I go to the doctors. All of a sudden, my palms are sweaty, my heart rate is increased, because there's some level where
Stress.
you're not really trusting this medical
Mm-hmm.
professional. I don't really trust every single thing that you're going to say. I don't know if I really trust that you have my best interest at heart. And this actual lack of trust can lead downstream to a whole variety of factors. So I actually do have another study where we're looking at the effect of medical mistrust in terms of how we can communicate with our patient, how oncologists specifically communicate with older adults. Because we know that if it is that patients are more trusting of their physician, they will tell their physician things that impact their care. So an
Mm-hmm.
example, if we're thinking about an older patient or any patient undergoing cancer treatment, if this patient, especially an older patient, is falling every single time they walk, they have really bad balance issues, they're falling. If the
Mm-hmm.
oncologist knows this, the type of treatment that the oncologist might recommend to the patient might be different. But if
Right.
I don't trust you to tell you that I am falling, you as a doctor is never going to know that I am falling. And so
Right.
how you make decisions about how to treat me is going to be very different. And so we have some work that we try to understand how can we improve the way that patients and their oncologists communicate. Can the oncologist and oncology team, so that includes not just the doctor, but the nurses and the physical
Mm-hmm.
therapists and everybody who's in that treatment team, can we understand factors in which that we can improve the way they communicate with their older patients to improve that communication so that they can really understand a lot of factors that's going into a lot of these frailty related factors that is
Mm-hmm.
important when we're making treatment decisions, because there's lots of research, and we can, if we just have to turn on the news and
Yeah.
show that there are differences in the way that patients are treated depending on their race. If you're treated differently, your outcomes are going to be different, right? So if
Mm-hmm.
you're already treating me differently from upfront, the likelihood of me being cured of my cancer is going to be a lot differently. But if can we change some things upstream in terms of how we communicate, that can change downstream a lot of the outcomes for these patients. So
Right.
some of the things that we're looking at upstream is that can we, in this aspect, understand how we can change communication patterns. So that's what I'm doing in my sphere, but there's many things that can be done. Ultimately, we need to really have structural and systemic changes, but we can take little chunks of these systemic
Yeah.
and structural changes that we can do things for.
Right, but it's interesting that you mentioned the communication between the doctors and the patients, because I can see, I mean, just by reading the news locally here, that there is definitely room for more understanding between that, especially in the area of cancer patients. And I'm talking based on experience with relatives and so on, where where the patient is telling the doctor, this is what I'm experiencing, and the doctor sometimes, just kind of throw it away, or just, disregard it, I should say, or, for whatever reason. But I can see where your research is pretty important in at least beginning to transform that whole dynamic. And I mean, I would really hope that that the research could probably apply here too, really, really, because I think we
I
need it. I think we
mhm.
definitely need it, you know
Most definitely. I don't think that my research is applicable only into the US. I think it can be applicable into the Caribbean and Trinidad specific as well. Um, and so, that's definitely the hope that things that we learn here can be applied globally.
Absolutely. All right. So, okay. So, of course, it's Women's Month, International Women's Day around the corner, and and you are a cisgendered Caribbean woman who's a wife and a mother. And so, my question is, I'm just pivoting a little bit. Um, is your how should I say, your experience in pursuit of your career, have you encountered mainly men in your professional sphere, and do you think it matters?
Oh, it definitely does matter, right?
Okay,
um, so,
tell me more.
As we're thinking about disparities, I've been thinking about talking so much about the disparities and health-related disparities as we focus on Black patients of African descent and some of their outcomes. But we know that there's disparities in terms of like gender, right? If we look at our population, which is about 50% male, 50% female, approximately, and we start looking at how many people are male versus female finish high school, and then what percentage finish college, and what percentage finish higher education, and what percentage, that number changes, and the dynamic changes so much that when it is that you look at some of these, the way that our world is structured is still very has a huge hierarchy, right? If at the top of the hierarchy, there's mostly men, right? And they, unfortunately, that's still the power that and we women always have to fight still to get a seat at the table, and so it definitely does, it makes an impact. If I don't have a seat at the table, is my voice being heard? And then because we're in the COVID era, it makes us think about a lot about this, right? When we have been seeing, and the numbers have been showing that the number of women leaving the workforce is substantial as COVID has happened. And so we're going to be starting to see, our gaps between the disparity between male and female was starting to close, and COVID has happened to make it wider again.
Right. Yeah.
And so, you definitely experience it. I can tell you many different ways. I can give you some examples, having your kids,
right.
and you're in grad school and you want to breastfeed your kid. Like, why is it that I don't have a proper place to pump so that I can be able to pump and provide, milk for my kids? There was no pumping, very limited, or very, very difficult to find a place that you can be able to pump to be able to continue breastfeeding your kid. Where it is that men will not have that problem, right? They can continue doing their research. If I'm doing my research, I have to take more time out of my day to pump, so I need more breaks during my day to be able to pump. Because I'm my husband didn't have that. He can go back to work and he didn't have to worry about how he's going to pump and bring the pumping supplies and all those different things. So yeah, there's a huge difference that in what I've experienced and things that you have additional challenges that unfortunately, even in 2022, it's sad that we have to say that we still have to overcome in order to try and be our best selves, not just at work, but in everything that we do.
Yeah. And I really appreciate that you brought a practical example, because you don't really hear women in any career sometimes be open about the very real issues that we encounter. And for sure, needing a place to breastfeed and or pump, or what that reality is very real to a new mother. And I mean, only a percentage of the society will truly understand the need. And if it's so basic to us, but yet it's not met in a lot of respects. So I appreciate the example that you brought, because I mean, sometimes I feel it's hard to ask a question about womanhood and the realities of being a woman, because you don't want it to seem as though you're somehow not able to perform as well as a man, because you have to deal with these things. But the reality is not so much that you can't perform, it's just that you need these supportive mechanisms to be able to compete, or to even reach your full potential. So I really do appreciate the example.
And that's where the whole idea of equity comes in, right? So equity is so different than equality, because there's a lot of things that we say that women are equal to men, or we want to get equal treatment. But what we don't really want equal treatment, because if it's equal treatment, you're going to give me the same amount of time breaks as men. But my equitable treatment is that you need to give me more time because I have to pump because I have my kid. That will be the equitable solution, right? Or maybe you need to give me more flexible hours because I have other responsibilities. And so, I think as we're thinking about, again, everything that we can do, we can all make a stand, and we can all. So for me, it's really important that people share these stories, like the realistic stories, because it really tells the things that we have to encounter. Because I think also for younger people coming up, sometimes it just, as I know growing up, you just saw somebody and like, I don't understand how they were able to do it. It just seemed like they couldn't do it
Exactly.
all. And then you like say like, why am I struggling so much? Like, so and so was able to do it all. And then you really start speaking to them like, nope, this is what I did. And you're like, oh, I really went through the exact same thing.
Exactly. Or I
And
went
then
in my car.
exactly. And so I do appreciate when people are really just like, just real about some of the struggles that we have to face. And, as we, we progress in our own careers, we need to make sure that we don't have the mindset that, well, I struggle this way, so you should struggle this way too. Should be like, I struggle this way. How can I make it better so you don't have to struggle this way too? Because we don't want to end up getting to a position and then being gatekeepers, where it is that other women cannot come behind us because we're like, well, I did it. Why can't you do it? No, I did it and that was not right. What can we do now to make it better for the people that's coming on beyond us? And I think that all of us can do that in our own way. So maybe fighting or telling them, listen, you really need to put a special place with an electrical plug. That's another thing. They'll give you a pumping room with no plug. So I need a plug, an outlet so I can plug in my pump so that I can be able to pump, and then not only for me, but for the people that's coming up after me. And so like these are the different things that we can do to make sure that as to use, each one of us have some level of privilege. So as we move up a little bit more in our career, we can use our privilege to fight for those who are in the positions we were before.
Absolutely. Yeah. Absolutely. I really like that. Okay, so I'm gonna try to roll through some of these other questions so I don't keep you much longer. But so let me ask you then, what was there ever a moment throughout your career thus far that you've had, let's say, that you would rate as one of your most defining experiences then? And what can you tell us about it? It's a tough one.
Yeah, it's a tough one. So I guess defining in which way, like defining in terms of what it is I wanted to do or challenge,
or defining or inspiring, anything that stands out in your mind as a pivotal moment, perhaps in your career path. I'm sure you probably have a lot because a lot of people tend to say they have more than one. So
yeah, so definitely what it is that I came to the US to do, I'm not doing, so there were definitely a lot of wines along my path. But I think there are definitely different ones, but I will say like maybe in the spirit of Women's Day, I would say that there were several women that I have encountered, people who are ahead of me in my career, people who are on the same, my peer mentors, that have made the defining moment. I think knowing that that you are not alone. So having people tell me that I am not alone. And there's not a one size fit all, because I feel like society tells us that this is the way that you should be a working mom. But there's no one way, right? And so I think that definitely for me as a working wife and mother, my biggest defining moment would have been when it is I started in the group that I am with right now, which has quite a few also mothers who are working, who are also researchers. And realizing that there really wasn't a one size fit all, right? So when it is that I wasn't seeing it, you start questioning, like, really, can I do this? Because I don't see anybody who's doing, mothering and working the way that I do. But then, getting to a point where you might meet other people and be like, oh, it's okay. Maybe I parent a little bit different than my mom, or I parent a little bit differently than my best friend. But I'm okay because we are both raising quite competent children that are happy and will, live their best lives. But we don't have to do it the exact same way. And I think so. My defining moment would have been when it is that I found people that helped me realize that it was okay for me to do it my way, as long as, because at the end of the day, my kids were happy, they're healthy, and they're doing well, right? So I think that so at least in terms of that balance between being a working mom that was probably the best defining moment that made it okay for me.
Yeah. And I could see that even, because your family and your children is such a core part of who you are, but then your research is also important. And it's kind of always, I think, always inspiring where you can find that you're able to balance the two in a way that you don't feel tug from either side kind of way, So based on what I'm hearing, I kind of hearing that in what you're saying to an extent.
Yeah, I mean, there's definitely, that I don't know if I've achieved balance. I heard sometimes that, it's
Work
not,
in
it's just like,
progress.
it's like a work in progress,
Yeah.
But I think, like I said, like at the end of the day, when it is that you sit down, because I remember, like, I didn't go to all the mommy and me sing along in the library thing. I just, that was, like, I couldn't do that. And
Yeah.
so I wonder, like, what kind of mom am I? And I'm not going to like all the other colleagues going to taking their kids to the library and they're singing with the guitar and they're doing these sing-alongs. And then, just knowing that that was okay, because then I did other things with my kids. And if I sat back and I looked at my kids, are they healthy? Are they happy?
Yeah.
Am I raising them to be productive members of society? Am I raising them to be members of society that will make change? And I can answer yes to all of those. Then I'm doing a great job. I'm winning.
Yes.
And so I think also for women, like, we have to sometimes let go of this ideology that we have to live to some kind of like godlike standards, because it's not true, because when we try to do that, we feel like if we fail, right? We feel like we are failures when in reality we aren't, because our children, if we use those metrics, they're doing well, they're flourishing, right?
Yeah.
They might have eaten cereal for dinner tonight, but they're doing really well. And they thought it was a greatest treat because mommy gave them cereal for dinner. We had breakfast for dinner because mommy got home a little bit late today. And that's fine.
Yeah.
And so I think, like, so I'm very happy that you're doing, a series like this, because I think it's important for us, because this is a lot of times my friends and I, we talk about it. Like, we're doing good and the kids are doing well, but there's this standard, this mythical standards that we have placed on us as women that we should be achieving, but it's not the reality. And if we try to really achieve that, we're going to burn out. We're going to burn out and we'll become sick. And it's not realistic. It's not healthy for any one of us, including our kids.
Trying to reach those ideals that are really not ideals.
No, they're not.
Yeah. So, okay. So as we wrap up, I mean, along that vein, what advice would you give to maybe other girls or anyone really who may be considering a career in science or cancer research?
I would say what was really important, and there was a series that came out that I liked it. What does a scientist look like? Because, sometimes we have this idea of what a scientist looks like. And then if we don't see that person reflected in ourselves, we don't think that we are capable of doing it. But a scientist that looks like everything, like anything that you can imagine a person looking like, that's what a scientist can look like. And it's just a matter of making sure that you get the right mentorship if you need to. Don't be afraid to ask for help. Don't be afraid to ask for advice. Sometimes we just have to like put ourselves out there, because I think that no matter what, if this is your passion, you can do it. Even though society will say, well, you didn't get all A's in this, you're not able to do it. Or my mother is not a doctor, or nobody in my family is not a doctor, I can't do it. Those are all myths. Your path might be a little bit harder, but it doesn't mean that you can't do it. It's just because the system is flawed. It's not anything about you. It's the system. And we can all do it. You just have to try and reach out to other people who might be able to help you that navigate and overcome systemic challenges.
Yes. You're still there.
Am I still here? Okay,
Yeah,
sorry.
just a little bit, but that's fine.
Okay, yes. So if you reach out to people, I found out, like, sometimes I'm afraid to reach out to someone. And you reach out to people are more willing to help than you might think. I saw you, I was really inspired by your talk. Are you willing to talk to me about how you do X? And people are more willing than not to say, yes, I'm so happy to tell you about my path. I'm so happy to tell you about how I got here. I'm happy to tell you about my challenges and how I overcame those challenges.
Right.
So definitely reach out. And we in a world where there's social media, is really easy to be connected, to find people who are like you, who you can reach out to say, how did you do it? How did you get from A to B? Um,
Excellent. So reach out, don't be shy, and ask for help when you need it. It's very
mhm.
good. So we are grateful for your work, and we wish you continued success, you and your peers, ultimately, as you are seeking to seek better treatment for persons and older adults with cancer, and I think giving us a chance to have a better quality of life as we age, and I dare say even a greater chance of successfully battling a disease and aging gracefully. So for that, I'm very thankful, and thankful that you came and talked to us today on the Quick Crack Science Live show. For those of you who are listening, thank you for joining us. You could read more about Dr. Nikesha Gilmore on her work by checking out her page at the University of Rochester's website, www.urmc.rochester.edu. And if you have any questions, please leave them in the comments, and we will definitely try to address them perhaps in following today's recording. And so thank you for joining us. I don't know, Dr. Gilmore, if you want to leave your Twitter handle, if you like, and if you can kind of, maybe you have questions for her, so you can ask her on Twitter. So up to you.
Thank you so very much for having me. This was, as always, a pleasure to chat about what I do and to chat about what I care about and what I'm passionate about. So thank you for having me. My Twitter handle is at Nikesha Gilmore, and that you will be able to see more of what it is research that I'm involved in and things like that on there. So thank you again. Thank you.
Thank you. Thank you, everyone. If you've enjoyed today's program and you want to see more like it, do let us know, like, comment, share. And, we really want to tell your science story. So let us know. You can visit us at upcomspr.com. Bye for now.